I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 20. Be sure to subscribe to this podcast, and you'll never miss an episode on how to naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
I'm so glad you spend time with us. I really enjoy this time together. Because I got all this information and I don't want to keep it a secret. I want to share it with you. And it really works. That was my catchphrase for a long time. Healthcare that really works. Now my catchphrase is naturally, we want to get you well and keep you well. I could use both, right? Nobody's going to argue with me if I use both. Because naturally, get to play on words, naturally I want to get you well and keep you well. Because that really is my goal. I want to show you how to save money, feel better, live longer, have more energy, lose weight. There's no downside to getting healthy. Well, there is. I lied to you. The downside of getting healthy is many of the foods you really like right now, you can't eat anymore. Because they're no good for you. And so, people say, well, Dr. Joe, do you miss any of the foods? And I said, I miss meatball sandwiches with provolone cheese on a good Italian bread. Growing up in Hoboken, New Jersey, we used to eat a lot of that. But also the meat then was different. The meats didn't have the steroids, chemicals, hormones, antibiotics, pesticides, herbicides, genetically modified foods. Same thing with the cheese. And we ate a lot more vegetables. And we were outside a lot more. And we were a lot more active. We didn't have cell phones. We didn't have computers. I mean, those of you old enough to remember those days, they were years ago when dinosaurs roamed the earth. It was a lot different. It was a different world. We walked everywhere. I walked to high school. I took the bus once in 4 years of high school. And I had to walk one direction to get the bus and the other direction to go to high school. And it was probably about 1.5 mile, 2-mile walk. But I'd stop at Jim Zawicki's house and we'd meet Vern Pittman on the corner. And then Bill Kohler would join us and we'd walk down to school together, the four of us, every day. It was just expected. And if one of them didn't show up, well, they were sick. And we just walked on without them. So, yeah, it was a different world. We walked to football practice. I remember that. High school was not near the football field, so we had to walk to football practice. So it was a different world, but I want you to go back to those times if you can when it comes to food. But we have trouble doing that now. Because even a lot of wheat now, a lot of times the commercial wheat that you eat, they spray it with glyphosate, which is weed killer, to kill the wheat so that it's easier to harvest. And so it makes sense, takes the stress off the machines, and you harvest the wheat easier, and it's cheaper. But now this glyphosate, this weed killer, is left on the wheat, and you get to eat that. Little bits. But the problem is, they did some studies recently, and they found that almost everyone in this country has glyphosate residue in their body, in the urine. And glyphosate can kill the bacteria in your colon, killing off the good bacteria, the probiotics. And that can affect your immune system. It affects your hormone system. I just read a study, too, that probiotics can help people with blood pressure issues because it affects the bacteria in your colon, which affects your immune system and everything else. So it's another product I made, Dr. Joe's Probiotics, because so many people have messed up their system and they have problems. They drink chlorinated water. What does chlorine do? Chlorine kills bacteria in your pool. Well, guess what? It kills bacteria in your colon as well. That's why I recommend a water filter. We have some on my website if you want to look at them, drjoeesposito.com. But we have a probiotic supplement, very popular. Because people take it and they say it takes a while to rebuild the colon, but they go, wow, this stuff really works great. I'm amazed. Their immune system is better. Last winter, when everybody was sick, people were dying from the flu. Remember that? I didn't even have a runny nose. Because I keep my bacteria, my colon really healthy. Dr. Joe's Super Greens and Dr. Joe's Essential Source. I took the probiotics then. I take adrenal support to keep my adrenals working because that helps the immune system, helps energy, helps the sex hormones, helps inflammation. So what I'm doing works. I remember 30 years ago when I got into this world, and I'm thinking, gosh, I hope this works. It'll be interesting to see what happens when I'm old. Well, now I'm old, and it works. I can vouch for it. I was right. Made a gamble there, and it took off. So let's talk about ways to keep yourself healthy. And this is a 10-second health check. I want you to take your pulse, take the first 2 fingers of one hand and put it on the inside of the opposite wrist just below the thumb. and kind of follow the thumb down. There's a little gully in there, if you will, right to the side of the ligament in the middle there. And you'll feel your pulse. If you don't know how to do it, somebody can show you. And take your pulse for 10 seconds and multiply it by 6, and that's how many beats per second you have, because there's 60 seconds in a minute. See how you did that? Normal range is about 60 to 100 beats per minute. I think 100 beats a minute is too fast. By the way, normal and average are two different things. Average is 60 to 100. Normal is more like 60, 70, 80 maybe. Average is what everybody else has. Normal is what you should be. So if you can keep your blood, your pulse down, that's a good thing. Also, you want to make sure it's the same on both sides, and do it at the same time of the day. Usually wake up in the morning. This way you didn't have coffee or tea, or you didn't get excited, you didn't get, bad email. And do it every day. And if you start to see a big change, significantly, maybe 5-10 beats per day is not going to change much, but if you see a big change, or if you notice one side is different than the other, substantially different, you definitely want to go get your doctor to check that out. You might want to go see your medical doctor and let them do a cardiology test on you, and just make sure that everything is working the way it's supposed to, because it could be a sign of something bad. Also, if you stand up quickly. Anybody stand up quickly and get dizzy? Does that happen to you? That's called postural hypotension. Hypo meaning low, tension meaning pressure. Postural meaning a change of posture and your blood pressure drops. That's usually a sign of adrenal insufficiency. Remember your adrenal glands? We talked about them. Now, the adrenal glands produce energy. They produce adrenaline. They produce prostaglandins, which help control inflammation. And they also produce pregnenolone, which becomes DHEA, which becomes your sex hormones if you're healthy. If you're under stress, the DHEA becomes cortisol, which is your stress hormone. And short-term, cortisol is good for you. Long-term, cortisol is really bad for you. It can ultimately kill you, but it causes you to lay down fat and things like that. So you might want to make sure your adrenals are working. So if you stand up quickly and get dizzy, postural hypotension, you might want to start feeding your adrenal glands. Dr. Joe's adrenal support. See how this all ties together so nicely? I take adrenal support every day, because as you get older, organs get weaker. I want to feed them. And it's not going to give you a rush of energy. It's going to feed your adrenal glands so that they start working normally again. See how easy that was? Another thing, I'm thinking about supplements because my brain races here, is enzymes. You need enzymes. You heard me talk about enzymes a lot, but I just read a study on weight loss. And you need an enzyme called lipase. Lipase, lipid, fat, breaks down fat. And we're finding now that people have trouble losing weight might be low in lipase. And so what do? Well, we got to get our enzyme levels built up. Where does lipase produce? Lipase is produced in your pancreas. Most of you are stressing your pancreas every day, right? You're eating too much sugar. And your pancreas not only produces insulin, it produces amylase, lipase, and protease to break down fats, carbohydrates, and proteins. And then also produces essentially baking soda to neutralize the contents as they come out of your stomach into your small intestine. Because if the stomach acid gets into your small intestine, it can eat a hole in your small intestine, and that's called an ulcer. Right. So the pancreas is really important, and that's why pancreatic cancer is so deadly, because it does so many things. So what you can do is help the pancreas by taking the stress off the pancreas, making it produce less enzymes by eating raw foods. So one meal a day should be raw. Salad, broccoli, cucumbers, tomatoes, avocados, guacamole, fine with that. And then making sure you're getting lipase in your diet, and things like avocados have lipase in them. And you can take a digestive enzyme, Dr. Joe's digestive enzymes. Those are on the website too. And I want you to take them between meals. Because if you take this specifically, if you take them with meals, the digestive enzymes digest the food. If you take them between meals, they get absorbed into your blood system and then go through your blood and do things. So that's why it's a good idea for this case. If you're trying to break down your fat, having trouble losing fat, you might want to consider Dr. Joe's digestive enzymes between meals, between breakfast and lunch, between lunch and dinner, and then right before you go to bed. And it's really cool. That's a little trick. Add cinnamon to your diet. Cinnamon can help stabilize your blood sugar so you don't get the highs and lows. Dr. Joe's Super Greens, Dr. Joe's Essential Source help make you feel full so you eat less food. So you see, I got it all laid out for you. You give me the problem, I got the answer for you. I've been doing this for 35 years. You don't have to reinvent the wheel. You just have to follow the advice of the experts. In this case, expert. Another thing that makes you feel good. Oh, by the way, those supplements are on my website, drjoeesposito.com. Also available on Amazon. If you have an Amazon account, you can order it there. It's a little easier if you have that account. Either way, or come by our offices. We have offices in Marietta, Duluth, and Stockbridge in the Atlanta area, and that's going to save you shipping costs. Because if we ship them, we got to charge you for it. But if you come by and pick them up, we don't pay the post office. And I'm okay not paying the post office. Got to laugh more. Really important. I love laugh. I love watching cartoons. I love watching comedy shows. Whenever I have the opportunity to watch anything, it's either science, like exploration stuff, or I'm watching comedy. And when you laugh, it stimulates dopamine and endorphins in your brain, which makes you feel good. But research shows that a good laugh increases your body's secretion of immune-boosting growth hormones and endorphins. So it can actually help you prevent getting sick. If you are sick, watch comedy. Don't watch tragedy. Don't watch drama. Watch comedies, because you got to get the body healthy and keep the immune system strong. And one way to do that is make sure your bacteria in your colon are strong, because 70 to 80% of your immune system is in your digestive system. See how easy this is? It's not hard. It's easy. It's kind of fun. Now, got an email the other day. I have to remember this. And the patient said, Dr. Joe, you're brilliant, blah, 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 all accolades, but you talk too fast. She's right. I do talk fast. That's how us Jersey guys talk. We talk fast because we're always afraid we're going to get shot or something up there. But if you want to hear the shows again, we archive all our shows. And you can go to my website, drjoeesposito.com. You can also go to Stitcher, Google Play, and iTunes and look up the podcast For the Health of It. For the Health of It is the name of my first book, Eating Right for the Health of It. And it's also the name of our podcast. So you can binge listen all you want on my website. Also, subscribe to my YouTube channel. It's on my website, or you can just go to YouTube and look me up. Subscribe to the YouTube channel because we put out videos all the time now. We always have. And a lot of people are visual learners. And then sign up for my newsletter. That's on the website too, because we send out alerts when we have live lectures, when we have a new show, we have a new program, new research is out, and we don't want you to miss it. And also, many times I'll be giving lectures at an event where there's a fee. And I always tell the promoters I want free tickets to give to my listeners. So many times we'll send out an alert, hey, listen, use this code or something, get free tickets. So, but do all those. Sign up for my newsletter, subscribe to my YouTube channel, like me on Facebook, like me on Instagram. I just want to get all this information to you, and it's so much. And listen to what you want to, and don't listen to what you don't want to. It's all about you. But I've had a lot of people listen to 1,000+ hours of archive radio shows and lectures, and they walk out of there going, wow, not at one time, but Dr. Joe, I've learned so much when I'm in my car. Instead of listening to radio, I'll do this. I go to, now we have, of course, the podcasts on iTunes, Stitchers, and Google Play. For the Health of It is the name of it. And it's all available to you. So you can listen to that when you work out. I love it. I remember I was at a gym a while ago, and I was talking to somebody, and somebody walked by, and they looked at me. They kept staring at me, and I'm thinking, I'm not the best looking guy here. What are they doing? And the woman took her earpiece out and said, listen to this. And I put it in my ear. She was listening to our podcast. She goes, I heard your voice and I knew you were Dr. Joe. She goes, thank you for everything you do for us. We appreciate it. Isn't that cool? So you can binge listen if you want to now. All right, back to 60-second tips to get healthy. I'm going to say something nice about dairy products. And you never thought I'd say that, right? I'm not a big dairy fan. People trying to quit smoking can stifle cravings with a sip of milk. One sip, folks. This is not a gallon. Researchers from Duke University, nearly 20% of people that smoked agreed that milk-made cigarettes taste bad. Your brain will eventually connect the taste of milk with a decreased desire to smoke, and that can help you quit smoking. Because I started a lot of my lectures years ago with the 7 deadly sins of nutrition. And then I said, well, there's really 8. If you smoke, you can pretty much ignore everything else I'm going to say, because that's the most important thing you need to do is give up the cigarettes. And so this is just another tip. If you do smoke, try it. Now, only use organic milk, because we don't want all the steroids, hormones, pesticides, and other chemicals in your body. So take a sip of organic milk, swish it around in your mouth, swallow it, and then try smoking. And 20% of people say it's bad. And if you do this on a regular basis, it'll train your body to not like cigarettes. It's like taking the supplement Gymnema. Gymnema, G-Y-M-N-E-M-A, and I know a lot of you are going to email me. How did you spell that, Dr. Joe? G what? Gymnema. You can send me an email, and I'll send you the spelling. But Gymnema, when you chew it, it's a capsule, makes sugar taste bad. It's a coolest trick in the world. So you take a Gymnema capsule. If you call my office, it's not on my website. We use a different company to get them from. But if you call my office or send me an email, we can hook you up with it. And just chew it and then try eating something sweet. And you'll find that sweet thing doesn't taste good. It's so cool. And if you take Gymnema on a daily basis, it helps stabilize your blood sugar along with cinnamon so that you don't get your sugar cravings. How cool is that? And then you take Dr. Joe's Super Greens and Dr. Joe's Essential Source, because that's a minimum amount of nutrients you need every day. And that'll help keep you full, make you feel full anyway. And so now you're putting together a plan. Most of you have health insurance, but you don't have a health plan. This is a health plan. See how cool it is? And if you'd like to become outpatient, we would love the opportunity. My doctors would love the opportunity to meet with you and have you become outpatients. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. Go to my website, drjoeesposito.com, or just Google Dr. Joe, and we will set you up a time to come see us. And we will check your spine. We'll check your digestive system for acid reflux, heartburn, burping, gas, bloating. Many times there's an adjustment we can do to fix that. And we'll also do a dietary workup on you. And we accept people with most insurances. If you don't have insurance, that's okay. It's extremely affordable. For what you get being a patient in our offices, we could charge quadruple that, and it's still, you'd be getting a deal. So if you want to go to make an appointment, drjoeesposito.com, or just Google Dr. Joe. And if you've ever been in a car accident, if the car was damaged, you were damaged. So as soon as you get in a car accident, as soon as possible, get to our offices so we can check you out. And the insurance company's a little sneaky. If you don't do it fast, and there's no definition of fast, they'll say, well, you weren't hurt because you didn't go to the doctor. So don't let the insurance company bully you when it comes to this. Come see us as soon as possible. That's for you, your friends, your family, and children. drjoeesposito.com, or just Google Dr. Joe. Now, your kitchen sponge. We have to talk about this. I know I've talked about it in the past. You need to do something about your sponge. A lot of you would not pass a health inspection in your own kitchen. And I know this. I've been to people's houses. These moist areas of little bits of food are a breeding ground for germs like Salmonella, E. coli, germs that can spread to every part of your body every time, if you use it, every time you wipe your counters down and then wash your dishes with it. So a real quick way to kill all those little critters, those little crusty crabs that live under the sea there, is put the sponge in a microwave. Make sure it doesn't have metal in it, of course. Put it in your microwave for about 30 seconds. Now, be careful. Different microwaves cook at different temperatures, and I already burned up a sponge years ago. I left it in there for too long. So try for 10 seconds, 20 seconds, 30 seconds, and it'll kill the bacteria. Now, I have 2 sponges in my house. And one sponge I'll put in a microwave on a regular basis, and the only reason I have a microwave is a little portable microwave oven just to use on my sponge. I have it in my pantry. I don't even keep it out because microwaves are extremely dangerous, so I wouldn't keep them out. So put the sponge in there, zap it, and whenever I run a new load of dishes, I'll take the sponge out of the dishwasher, put that in the sink, take the one in the sink and put it in the dishwasher. So I really want you to pay much better attention to your sponges because they really are a bad place. And for example, toothbrushes. That's another thing we can do. You might want to cover your toothbrush, or if you have, you can turn it upside down in water if you wanted to, because every time you flush your toilet, what you just put in a toilet evaporates into the air. You know that pleasant smell of toilets. And that smell contains things like E. coli. And it can settle on your toothbrush, and then you're brushing your teeth with it. So ideally was put the toothbrush in a different area, or cover it, put it in a jar if you want to, or put it in a cabinet drawer. But the more exposure your toothbrush gets to your toilet air, the more germs you can build up on it. So not a good idea. Make sure you're happy. Make sure you show gratitude. This is another thing that we can do, and it's 60 seconds or less to get healthy. Say thank you to people. Pick things up. Whenever I go hiking, I always pick up trash along the way, and I just throw it in my pocket. And when I get done, I just throw it away. No one sees you do it. You don't get bonus points for it. But when you do things that are nice, life is a lot easier. Open a door for people. Find a reason to say something nice. I call it catch someone doing something good. And then tell them about it. If you work in an office or a family environment, whatever, mention that. Listen, I want to congratulate Damon for doing such a great job with that patient the other day on the phone in a staff meeting. That's something I might say in my staff meetings. You can do it, and it's amazing what happens. And you want people to like you? Say nice things about them. It's not hard. It's easy. So, in fact, I got a show in the queue here on what happens to your brain when you experience pleasure. It's really cool. And I got to do that in the next couple of weeks because it talks about how the brain changes, physically changes when you experience pleasure. And one of the easiest ways to experience pleasure is do something nice for somebody so that they like you. We all like to be liked. And so that'll be a fun one. And the brain actually changes its physical structure. It's called plasticity. The brain has plasticity in it. Plastic meaning it can change its shape. So it's just a cool little thing. That's kind of nice. Swiss researchers found that people fell asleep quickest when their hands and feet were warm. This happens because warm feet and hands cause blood vessels to enlarge, and that allows more heat to escape from the body, which lowers your core temperature, which allows you to fall asleep easier. So that's why even if you sleep without a blanket on, a lot of times you like to put your feet under the blanket. That's just one of the reasons why. So in the winter, especially if it's cold, putting socks on might help you fall asleep in about half the time that it would take somebody else. Blueberries. Talking about burning fat. I forgot to add this in my fat burning thing. We're coming up toward the end of the show here. Blueberries may aid in burning belly fat. It can decrease cardiovascular risk. It can reduce your risk of diabetes. It can help balance out your hormones. And this is according to the University of Michigan Cardiovascular Center. They did a study at the university, and they found rats consuming only 2% of their diet in blueberries, which is not a whole lot, reduced abdominal fat within 90 days, as well as lowering triglyceride levels and increasing insulin sensitivity, meaning your body received insulin and sugar more efficiently. The results were thought to be the result of a high percentage of antioxidants that help rid the body of toxins, and they naturally occur in blueberries. They also occur in Dr. Joe's Super Greens and Dr. Joe's Essential Source. Great sources of antioxidants. Now, what a lot of folks do is when they make their smoothie in the morning, they'll throw in a scoop of Dr. Joe's Super Greens, a scoop of Dr. Joe's Essential Source. I use coconut milk or almond milk because I don't do animal products. And then you can throw in a little flaxseed to get the omega-3 for your skin. And then you can also throw in some blueberries. Adds a nice flavor. And those antioxidants are just off the chart for you. Another reason to take Dr. Joe's Super Greens and Dr. Joe's Essential Source, which of course are available on the website. Say it with me. drjoeesposito.com, or just Google Dr. Joe. And that's why we have the supplements there. That's why we have the books there. That's why we have the podcast there. Also, if you go to, like I said, Stitcher, iTunes, or Google Play, just look up For the Health of It, and the podcasts are there as well. My books are there, Eating Right for the Health of It, Prescription for Extreme Health. So much information, folks. And you can take as little as you want or as much as you want and start using it, and just start doing a little bit every day. It's amazing how well it works. And here's my challenge to you. And I tell my patients this. Do everything I say for 60 days. If you're a chiropractic patient, follow your chiropractic visits. Let us work on your stomach. Take the supplements I recommend. Change your diet. Eat more fruits, vegetables, nuts, and seeds. Stay away from alcohol, meat, sugar, dairy, coffee, soda, and artificial sweetener. Give me 60 days. Prove me right or prove me wrong. But you got to make the commitment to do it. And I tell people that too. If you're going to come in as a patient, I want you to be ready to make some changes. If you're not ready to make changes, if you just want to ask questions, send me an email through the website, drjoeesposito.com, or just Google Dr. Joe. I'm more than happy to answer your questions. But if you're serious about wanting to get well, start listening to the podcast. Subscribe to my YouTube channel. Subscribe to my newsletter. And we send you out a lot of good tips and a lot of times presents on the newsletter. Read the articles that are on my website. Get my books. And start to learn how to get well. I can't imagine a better investment with a better rate of return than having your health. We watch the stock market goes up, stock market went down. Oh my gosh, this is good investment, it's good stocks, a bad stock, bonds. What should I do? I don't know what to do. It's so confusing. Getting healthy is the best investment you'll ever make. I promise you. I was very sick as a child, and I know what it's like to be sick. I know what it's like to be healthy. And I see you as patients every day in our offices. And everyone who does it right, usually, I can't make a promise, usually sees some amazing results. And they always say, why didn't I do this sooner? Why did I suffer so much? So if you want to get at least Super Green's an essential source, folks, but the adrenal supplement's a good idea. The probiotics are great for the colon. The digestive enzymes have lipase to help break down fat in your body. Take them between meals, not during meals. If you want to do that, if you want to digest your food, take them with meals. All of that information on the website, drjoeesposito.com. If you want to make an appointment to come see us in the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. We would love the opportunity to meet with you, your friends, and your family and help you get well and stay well. And if you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. So you want to get that checked as soon as possible. Even if it was 50 years ago, every day that goes by is not helping. It's only hurting in most cases. So go to my website right now, drjoeesposito.com, or just Google Dr. Joe. We'll set you up a time to come see us. The supplements are all on the website, also available on Amazon if you have an Amazon account. Folks, we want to naturally get you well and keep you well. Thanks for listening. We'll catch you next time.
Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 p.m. Eastern Standard Time on WSBRadio.com and on the WSB Radio app.